Firefighting in Canada this week is brought to you by VFIS of Canada, a division of CVIS Incorporated, Canada's largest insurer of firefighters. In this edition, scientists use silicone wristbands to track firefighter exposures. Then, Gateway Recovery Center launches a new mental health program for first responders. And Niagara Falls Fire Department requests naloxone training. A team of scientists affiliated with the Duke Cancer Institute use silicone wristbands and surveys to track chemical exposures in structural firefighters. The study was conducted with the Durham Fire Department in North Carolina and looked at firefighters' exposures to 134 chemicals through silicone wristbands. Silicone can record the presence of certain chemicals, Heather Stapleton, environmental science at Duke University, told EOS Science News. 20 firefighters wore the wristbands for 6 days in 3 different scenarios: on duty and fighting fires, on duty and not fighting fires, and off duty. Of the 134 chemicals, 71 were detected in more than 50% of wristbands. Phthalates were the most commonly detected compound across all 3 groups of firefighters. PFAS were equally found across all 3 groups of firefighters, and the researchers note the responding department did not use AFFF foams during this study. Significantly higher concentrate of PFOS were found in those on duty and responding to fires. Gateway Recovery Center, located in Peterborough, Ontario, is launching an additional mental health support program focusing on mood and anxiety. Statistics in a press release from Edgewood Health Network Canada showed that over 30% of first responders, military, and veterans in Ontario are seeking mental health treatment, and that 330 first responders are on a wait list for 40 mental health beds currently available at public health facilities in the province. Firefighting in Canada spoke with Sean Carter, clinical director at Gateway Recovery Center, about the new programming and what Gateway has accomplished in its first year of operation.
We launched in 2021, so in July of 2021, about a year ago. So we just recently celebrated our 1-year anniversary just this past weekend. And it was specifically designed to treat both PTSD and substance use as well. Some folks come to us just for the trauma processing piece of the work, and then some come for both trauma and the addiction side. We also have recently launched a mood and anxiety program. So again, this is programming that was already present in our other sites across the AHN network nationally. But we have identified that while PTSD or even sometimes substance use is first to come to mind when you think of some of the struggles that first responders may face, I think it would be wrong to assume that those are the only sort of mental health conditions that first responders face, that often there are symptoms of depression that are present, severe symptoms of both depression and anxiety as well. That if untreated can really sort of impact people's ability to recover from some of those other mental health conditions, or be able to, for example, return to work if they're off work, or thrive kind of in their home environment as well, which we know is so important, that the balance between the two.
The fire chief in Niagara Falls, Joe Zambito, obtained approval for his request that local politicians authorize him to enroll the department in Ontario's Naloxone Program, reports Niagara Falls Reviews. This approval means the department can now train in the awareness of opioid risk, protection, and patient care, and permit members to carry and administer naloxone nasal spray. A report to council found that medical response in relation to overdoses is trending upward, with 5% of medical calls being overdose-related in 2020 and 25% being related in 2021. As of May 31st, 110 of the 688 medical calls have been overdose-related. Thanks again to VFIS of Canada, a division of CVIS Incorporated, Canada's largest insurer of firefighters. Stay tuned for our next episode on Friday, August 5th.